Greetings, everyone. My name is Sheila E. Esong, and I'm the Engagement Director at Giffords, where I work to cultivate and strengthen our organization's strategic partnerships on a national, state, and local level. I'll be providing an outline and a brief summary and serving as your MC for today's webinar, which is, in fact, entitled The Tragic Intersection of Guns and COVID-19. What we know is that millions of Americans are living in a new reality, and it's really unclear for everyone when things are going to return to normal. Even the idea of what a normal, climate is going to look like, we're all really unsure about. What we do know, though, is that this coronavirus pandemic is not going to erase our nation's gun violence crisis. In some ways, it could actually aggravate it and make it worse. So for today's webinar, we're going to be covering critical issues related to gun violence prevention and gun safety policies during this very challenging time. Giffords staff have been working tirelessly across the country on a wide range of gun safety issues, and they will provide an overview on what's happening now, highlighting key resources and making recommendations for what policymakers and others can do to address the intersection of these public health crises. During today's webinar, you're going to hear from a number of different experts across the organization. We're going to start off by hearing from David Chipman, Senior Policy Advisor, and he's going to talk a little bit about background checks and panic buying. When David is completed, we're going to move over to Julia Weber, our Implementation Director, who's going to speak to you all about domestic violence and the tragic intersection of COVID-19. When Julia is completed, you're going to hear from Kelly Drain, our Research Manager, who's going to talk to you about suicide in the COVID-19 pandemic. After Kelly, we'll hear a little bit from Allison Anderman, Senior Counsel, who's going to talk about safe storage saving lives. And then we're going to transition over to Tiffany Garner, our Community Violence Initiative State Manager, who's going to discuss community violence intervention programs and the intersection of COVID-19. Last but certainly not least, you're going to hear from Adam Skaggs, our Chief Counsel and Policy Director, and he's going to talk a little bit about the gun store closures and the myths versus reality. When we're done with Adam's section of the program, we're going to transition into a question and answer portion, which I will lead. And at that point in time, we'll take questions from the viewers and the audience, and I will pivot that over to the respective expert, which will be able to then answer your question. I did want to also point out to everyone that this webinar is being recorded, and upon completion will be available on Giffords' website if you want to send this out or for further viewing. Awesome, great, we're ready to begin. So what we're going to do now, what I'm going to do now is I'm going to move things along, and I'm going to pass the baton over to my colleague, David Chipman. David is, like I mentioned, a Senior Policy Advisor here at Giffords, and he's going to talk to you all a little bit about background checks. David has been with the organization for some time and holds a number of different expertise related to law enforcement. David, you're on, and if you'd love to start by just giving people a little bit more about your background, that would be great.
Thanks for the introduction, Sheila. For 25 years, I served this country as an ATF special agent, and I did what people might expect. A lot of my career, I served on a SWAT team, disrupted gun trafficking, and arrested people who shouldn't have had guns in the first place. But later, as I moved through my career, I had the opportunity to work in ATF headquarters. And one of my most complex assignments was receiving all the information from the FBI NICS section regarding people who had attempted to buy guns and failed, and those that had actually been determined to be prohibited from having a gun after the gun had already been transferred. And these delayed denials caused us to have to assign agents across the country to try to recover thousands of guns that should never have been sold in the first place. And so today I want to take that expertise of knowing a lot about NICS data to describe to you the unique things that we saw beginning in February of this year regarding gun sales as a reaction to this pandemic, and sort of set the stage for each of the experts from Giffords to communicate to you individual risks that might flow from that. And that's how my beginning today will be structured. So let's begin with the data. So I think everyone can probably remember the first time they saw this now iconic photograph that actually Adam at the closing of our presentation is going to display in his PowerPoint of this line encirculating a gun store. What's interesting about that photo is the photo was taken on Sunday, March 15th of a gun store in Culver City, California. And the article that first published it came in March 16th. So as you see the data in front of you that's been produced by the FBI, on the left is the top 10 days in history for NICS checks on any given day. And you can see in that list, 5 of the top 10 days in history happened in the week following the photo that we all now have seen, and you will see later today if you haven't. And I think it can be said that through the end of February, sales were growing of guns, but there was something about that photo that I suspect just was fuel on the fire. When you look on the right side of data, that shows us the number of background checks at historical levels based on the highest weeks. And if you look at the top there, that week of March 16th of this year, which is the culmination of at least 5 of the days on the left, represents the most background checks ever conducted by the FBI relating to gun sales and other things in history. You should note that number 2 is that week following the shooting at Sandy Hook. So it is not that we have never seen levels of gun sales like this, but clearly we've never seen a peak like this, and we've never seen a volume over time. And so as you can see, 4 of the top weeks in history began at the end of March and continue, began at the end of February, which is ranked number 5 there, and continue through the end of March. The next slide will depict in maybe an easier way for you to digest that data. What this slide depicts is those weeks since the end of February through the end of March. And it seems clear that this volume of 600,000 to 800,000 background checks per week is sort of a tight band, except for that spike that occurs in the week following the photo. And then it comes back down in March. I'm very interested to, at the end of this month, see the data from NICS being released to see if this represents a downward trend of gun buying, a return to that narrow band, or something else. This could represent that there was a one-time spike in gun sales that will never return. We don't know yet, so more will be revealed. But I think that this is a good way to digest what's actually happening, which is there's a significant volume of gun sales. There has been a spike in that 1 week, and the rest is yet to unfold. Next. What's really important about NICS data, though, is at the top level, that level that is often reported to the media, is all background checks related to gun sales and other means. So if you go to get a concealed carry permit or your permit is renewed, they use the same gun background check system. So experts like myself and others know how to digest this data that NICS puts out, and we can back out those permit checks and really discover what are the checks for. And what this slide is depicting is what were the checks done for? Were they done for a handgun purchase, a long gun purchase, or something else? And so moving left to right, under the category of number 1, compares the number of handgun sales that triggered a background check in March of 2019 as compared to March of 2020 this year. And you can see there is a significant jump in these types of background checks. And although we don't really know how many people bought guns and who they were, this is a significant clue, as we would say in ATF, that more people were buying guns. And in this case, it appears that about 1.4 million handguns were purchased during the month of March. And this is an increase of almost 665,000 more than the previous year. And now moving left to right, I want to give you some details about the other types of gun purchases. The next would be long guns. Long guns would be defined as shotguns, rifles, your assault rifles would be included in there. And it looks like there was an increase to over 750,000 of these types of background checks for this type of gun purchase, over 430,000 of last year, which is an increase of about 320,000. The third category is other. What other means is that you can purchase items like a frame or a receiver, which is the part that has the serial number, and people often use that part to then buy other parts to build a gun at home on their own. And you can see in this area, there was a 30,000 unit increase up to 80,000. The next category would be multiple sales. That would be someone who came in and didn't just buy multiple guns, but bought multiple categories of guns, which would mean they bought a handgun and a long gun. And you can see in this case, there was a twofold increase. So that suggests to me that there was at least some kind of hoarding, perhaps panic buying that was unique, and that people who traditionally bought one gun or two gun, more people were now buying multiple guns. And so in the end, what does this mean? Over 2.25 million guns were probably at a minimum sold during the month of March this year, and that's over 1 million more than last year. So let it be clear, the pandemic caused people's behaviors to change, and now 1 million more guns have probably been transferred. But what we don't know, and we will not know for some time, is this an instance of people stockpiling guns? And what I would define as that is people who had guns who then bought more, or are these people coming to the gun store for the first time? Are these new gun owners who, because of this environment, bought a gun for the first time? Or is it some collection of both? And that's really important to our conversation today. Next. I want to explore, and this is what my primary concern that I'm going to share with you, is what makes a person decide for the first time to buy a gun. And so what I'm thinking of is that person who all the way their entire life through February of this year had made the personal decision that they did not need a gun. And then amidst this crisis, stress, concern, unknown, they for the first time bought a gun. And it was in an environment where we can almost be ensured that that person could not be trained with the gun. And I think part of this is the culture by which guns are being marketed today. The picture at the left depicts a former colleague of mine. His name is Roger Guthrie. Roger came to ATF following a career as an Army Ranger. He actually was one of the Rangers who survived the failed Desert One mission to rescue Iranian hostages. I think within the first couple of years of his service for ATF, he was on a drug raid in Detroit, was shot in the face with a shotgun, although you can't see it from his pleasant smile here, and went on to just a stellar career based on his expertise. And for years, when I was working in Detroit, I relied on him to execute those search warrants that were most dangerous. He was highly competent, highly trained, a mature operator. On the right is a depiction of two Navy SEALs. I don't know these SEALs, but I think that their reputation for expertise and competence is well known. And what the gun industry is marketing is this myth that for any American, if you buy a gun, you immediately transcend yourself into this level of competence as these types of operators. That on game day in a life or death situation, you would somehow operate like a character in Die Hard. But this isn't true, and I know this through my own SWAT training. It would be the same as if I went out and bought the same club set that Tiger Woods uses, and for the first time rolled onto a golf course and think I would break par. It's absurd, and it's dangerous. To add a little brevity, which is, I think, a cultural trait of my law enforcement background. This is really serious stuff, though. And I don't want to, spoiler alert, I don't want to spoil Tiger King for anyone who's avoided watching that. I didn't avoid it. But you can see how the presence of a gun changes the behavior of an individual and how that can lead to very dangerous outcomes. And I really don't want to be a spoiler, but within that show, you see a whole variety of outcomes, negative outcomes, that we will discuss today. And so that is my primary concern as a trained 25-year veteran of ATF. It's not as much that existing gun owners decided to buy some more ammo. It is the thought that maybe gun owners who had never thought of buying a gun before now believe that they are ready and they have made their homes safer, and I fear they've made them deadlier. And that's what I have today. Thank you.
Thank you so much, David. Thank you for all of that. That was really, really informative. At this time, I'm gonna pass things along to my colleague, Julia Weber, who is Giffords Implementation Director, where she focuses on identifying ways to most effectively implement gun safety policies. Julia, I'm gonna pass things over to you. And if you could start by just giving folks a little bit more about your background, that would be awesome.
Thanks so much, Sheila, and thank you, David, as well. And thank you all for joining us today. As Sheila noted, I'm Julia Weber. I'm an attorney and social worker. I've been with Giffords Law Center most recently as implementation director starting in February. And prior to that, I focused on implementation of the gun violence restraining order under a fellowship with the Law Center. And my career over 20 plus years is focused on policy development, mostly with courts, focusing on civil, family, criminal law, restraining and protection orders, and teaching on race, gender, and domestic violence law. And I've served as an expert witness in domestic violence cases. And I'm very pleased to be here today to talk about issues related to firearms and domestic violence. So please, next slide. Thank you. So with the pandemic impacting us all in a variety of ways, so much is unprecedented in this moment. But I think it's important that we understand domestic violence isn't new. And that may be obvious to folks, but I just think we need to highlight that, because for too long, too many people, disproportionately women and children, have been unsafe in their homes and in their intimate or family relationships. But with stay-at-home orders, we've seen an increase in news coverage about domestic violence and to some extent child abuse as well. The No More campaign, which is dedicated to ending domestic violence and sexual assault by increasing awareness, inspiring action, and fueling culture change, has partnered with the National Domestic Violence Hotline on this public awareness campaign. There's no question at all that with coronavirus came increased isolation, decreased access to support services, safe housing, counseling, courts, healthcare resources, and decreased access as well to coworkers, teachers, and others who often play a protective role for those living with abuse. But even after we lift the stay-at-home orders, domestic violence will continue to be an issue we need to address. And when we combine the pandemic and domestic violence with access to firearms and the resulting potential for and reality of gun violence, we're talking about three separate but connected serious public health crises. Next slide, please. So domestic violence is complicated, and we certainly don't have time today to cover the topic in depth, but a succinct way of describing the dynamic is to talk about a culture of rulemaking. That domestic violence involves a pattern of exerting power and control over partners and family members. And Barbara Hart, a longtime advocate and researcher and attorney in the domestic violence field, worked with survivors and identified 4 rules those who harm family members or abusive partners impose based on those survivor reports. So first, the folks who are abusive believe that they get to make the rules in that relationship. They get to regulate family members' behavior. They demand unwavering respect and loyalty. Victims are generally prohibited from telling anyone about the abuse, and these rules are explicit as well as implied. They tend to also control whether the partner can leave the relationship or a shared home. And of course, in isolation, control is more easily exerted. We're hearing reports that some abusive partners are preventing victims from leaving the house to do essential jobs, while others are forcing them to continue working when they are sick. The virus is being used in a variety of ways as another tool of power and control. In California, we recently had a report of a mom who works in a hospital going to pick up her children for a custody exchange, where she reported that the father pulled out a gun and told her she can't see the children until the pandemic is over because he doesn't want them exposed to the virus as a result of her work. Additionally, coronavirus provides another way abusive partners might try to explain their behavior. A man who shot and killed his partner just last week considered killing himself, but reportedly didn't, so he could tell police that he had been stressed out about the virus and related money problems, and that he and his partner had argued before he killed her while she was napping in their home, highlighting the stress that he felt he was under as a result of the virus. Next slide, please. So while domestic violence is all too common experience for women and children across race, class, gender, identity, age, and culture, we also know there is diversity in how it's perpetrated. Guns are marketed often for self-defense, but actually have lethal consequences for those being victimized by intimate partners. So when firearms are present, and we just heard from David about how many more firearms may be in homes now, and domestic violence is being perpetrated, the risk of lethality increases significantly. We're getting reports from domestic violence agencies and hotlines showing anywhere from 10 to 80% increases in calls for help. But we also know there are some places where calls for help don't appear to be increasing. But we know it's too early to really understand what is happening. People cannot easily make calls, text, or go online when they are constantly in close proximity to someone who is controlling their environment. And even when we open up again, knowing how many firearms are out there, combined with economic uncertainty, reduced services, housing insecurity, and the prevalence of domestic violence, we have good reason to be concerned for months and for years to come, I imagine. Next slide, please. We also have to remember that firearms are not only used to kill in these situations. I've worked on cases where all a partner had to do was remind their partner that he owns a firearm and he isn't afraid to use it to keep her in check. This is a quote from the National Domestic Violence Hotline, and even prior to this pandemic, we know they had been reporting that they had been seeing an uptick in calls from victims reporting abuse that included firearms. Next slide, please. We also know that there are over 1 million women who have been shot or shot at by their partner. So it's not always lethal. There are folks walking around who have had that experience. Just a few weeks ago, there was a story of a man who reportedly had become increasingly despondent over the pandemic. He had recently lost his job, and he shot his longtime girlfriend multiple times in the back as she was trying to leave, and then shot and killed himself. We, I think, need to remember that the majority of intimate partner homicides result from gun violence, with more than one woman a day being killed by a partner with a firearm. And just last week, the Federal Office of Violence Against Women published an announcement on the Department of Justice website on the issue of firearms and intimate partner violence. And they noted that with this pandemic, quote, victims of domestic violence and sexual abuse are facing increased risk to their own personal safety. So the acting director said she, quote, strongly encourages families that have a gun in the home to take time to discuss and think about safety issues. And she noted that a gun should never be handled after consuming alcohol. So the DOJ is making these connections as well in the current climate. Healthcare providers can ask and educate patients about the risks of firearms in the home when there is also domestic violence. Same with community workers, and we'll talk a little bit about their role in interrupting violence at this time. We also can ask that legal services, courts, law enforcement be available to assist with restraining or protective orders or with criminal charges if, with some safety planning, any of those are identified as good options. So there are some things we can do. Next slide, please. Recognizing how critical safe housing is, I encourage folks to check out Safe Night, which is an app that allows people to donate any amount to help fund hotel rooms for victims. We also need to make sure local stay-at-home policies permit travel to escape domestic violence situations or to reach out for help. We need to support online and telephonic legal services, counseling, court services being provided remotely and available, so that, yes, it's important to have extension for restraining orders, for example, but it's also important to be able to get those orders dealt with expeditiously on a regular basis, because they can help exert some control over an abusive partner's behavior. And we can make referrals to the National Domestic Violence Hotline, which can assist 24 hours a day with safety planning, including addressing issues related to firearms, can provide information about local services. All of these referral services and policy developments have to be done with a focus on diversity, equity, and inclusion to ensure we provide effective responses as well. And we'll also be hearing more from my colleagues today about risks and opportunities to increase safety at home in our communities. And I'll just note, next slide, please, that we have content on our website at Giffords Law Center that addresses this issue. So I refer you to those resources. We have some addressing domestic violence, state court policies and procedures, and also about the other issues we are addressing today. So thank you very much, and I'll turn it back over to you, Sheila.
Thank you, Julia. Thank you for that. That was really informative, and I'm sure you'll have some questions when we get to the Q&A section at the end. Now I'm going to pass things along to my colleague, Kelly Drain, who is our research manager here at Giffords. Kelly is an expert on the nature and dynamics of gun violence in the United States, and she leads all of our research efforts, and her work informs all of the organization's work, from legislative to litigation, political, and of course, communications, and she backs it all up with evidence-based research. So at this time, I'll pass things over to Kelly, who will briefly introduce herself and jump right into the webinar.
Thanks so much, Sheila. So as Sheila said, I'm Kelly Drain. I serve as the research manager at Giffords Law Center. And I'm responsible for tracking all of the different research and data that we have on gun violence. And I've been studying this issue for more than 6 years now. So I'm very familiar with the literature on this issue. So I'm going to be talking about the intersections between the coronavirus pandemic and suicide. But before I dive into that, can you go to the next slide? Before I dive into that, I wanted to start by just grounding us all in what suicide has looked like the last few years in America, because I think it's really important that we're all on the same page about where we're coming from before we discuss how some of these numbers may change. So we know that nearly 46,000 Americans die by suicide each year. Half of these are gun suicides. And when we think about gun suicide or suicide in relation to the broader issue of gun violence, we know that suicides represent about 2/3 of gun deaths in this country. I also think it's really important that we all understand that the United States really stands alone in terms of its rate of suicide, particularly firearm suicide. So the US has a gun suicide rate 10 times greater than that of other comparable high-income countries. Next slide. And so just to build off that, I think it's really important that people understand the connection between guns and suicide in this country. We know that having a gun in the home triples the risk of suicide death for all household members, not just the gun owner, but the gun owner's spouse, the gun owner's children, and anyone else that lives in the home. And the primary reason that guns increase the risk of suicide so substantially is that guns are a uniquely lethal means of suicide. So just to put this in context, we know that about 3% of suicide attempts involving overdoses or self-poisoning will end in death. In comparison, 85 to 90% of suicide attempts with a firearm will end in death. So there's really quite a disparity in just how lethal suicide attempts with a firearm are. I also just want to mention that suicide attempts are often impulsive acts, utilizing whatever means are immediately available. We know that nearly half of people who attempt suicide do so within 10 minutes of making the decision to attempt. And there's a really clear body of academic research that shows that if we can take steps to make sure that a gun isn't accessible in these really critical moments, if we can put time and space and distance in between a person in crisis and a firearm, we can drastically reduce the likelihood that someone will die by suicide. I just want to point out that 90% of people who survive a suicide attempt do not go on to die by suicide. So importantly, if we can prevent someone from attempting suicide with a firearm, there's a much better chance that we can prevent a suicide death. So given this background, I want to get into the topic of how coronavirus may impact and actually exacerbate suicides in the United States. Suicide prevention researchers and advocates have been talking about how this pandemic may be sort of the perfect storm of factors that lead to increased suicide rates. When we look at the effects of the coronavirus pandemic on our society, I think there is this real concern that we're seeing an increase in some of the risk factors for suicide, and that those increases are happening alongside a decrease in some of the important protective factors or factors that can protect and mitigate against the risk of suicide. And I'm going to talk in detail about a couple of these factors. Next slide. So we're seeing a lot of data, and I would imagine that many people are feeling themselves that this pandemic is creating a lot of new stress and anxiety. A poll conducted at the end of March found that about 70% of Americans feel that this pandemic is creating significant stress in their lives. We're also seeing some very limited data that suggests there may have been an uptick in prescription medications for antidepressants, anti-anxiety medicines during the month of March, and that may be connected to some of the stress people are feeling related to the pandemic. We're also seeing pretty significant spikes in calls to mental health and suicide prevention hotlines. So the National Crisis text line has seen at least twice the normal volume of texts in the last few weeks. Local hotlines are also reporting 3, 4, even 5 times as many calls as normal. And at the same time that Americans are experiencing this increased stress, they're being asked to shelter in place, to physically distance themselves from others, which can disrupt access to friends, family, and other support networks, including, I think importantly, it may disrupt access to regular mental health services. We know that many people access mental health services through a primary care physician, and right now those services may not be accessible or safe to go to. And I think it's important to point out, just go back for 1 second. I think it's important to point out that these kinds of factors in the wake of a pandemic have actually been associated with increases in suicide. So researchers looked at the 2003 SARS pandemic and found that China, which was the country most affected by that particular pandemic, actually experienced an increase in its suicide rate associated with the pandemic. Suicides were particularly concentrated among older people who had the most anxiety and were the most socially isolated. So I think it's important that we're thinking about how these anxieties and stresses that we're seeing in America right now may actually translate into an increased risk for suicide. We also know that the pandemic has incited a major economic crisis. We're seeing, record-setting spikes in unemployment claims. If you look at the red lines on the right side of this chart, you can see that Those are actually the number of unemployment claims, and they're just unprecedented and reaching levels that we really haven't seen before. And unfortunately, we know that job loss and poor socioeconomic conditions in general are significant risk factors for suicide. We have research that shows after the Great Recession, which is that much smaller blip that you can see in the middle of the chart, but from 2007 to 2010, related to the Great Recession, the United States saw about 5,000 additional suicides, which researchers associate with that economic recession and the economic conditions of the time. And job loss in particular was a contributing factor in many of these additional suicides. So again, I think there's some precedent here to expect that we may see an exacerbation of the suicide epidemic in this country in relation to the coronavirus pandemic. So unfortunately, a lot of the risk factors created by the coronavirus pandemic don't look like they're going away anytime soon. I think we're going to be feeling anxiety and stress about this pandemic for months to come. And I think it will take some time for the economy to recover. But as we discussed before, one of the most critical ways to prevent suicide death is to put time, space, and distance between a person in crisis and firearms. So, David talked about how many more Americans are purchasing firearms, how we have more American households with firearms than we have in the past. And so I think it's really crucial at this time that we're thinking about means restriction and means disrupting access to firearms as a way to prevent suicide. We know that gun owners should store their firearms safely. Allison is going to talk a lot more about this, but it's a really critical step to preventing suicide among children and young adults that may access a parent's gun or someone else's gun in the home. We also know that families can take steps when they notice that someone in the house is displaying signs of suicidal behavior, that they can take steps to store firearms outside the home. So that might be with a law enforcement agency that would temporarily store the gun for suicide prevention. And in the most severe cases, when other remedies aren't viable options, we may need to rely on extreme risk laws in the states where this remedy is available. These are laws that allow law enforcement and other key members of the community to petition a court to remove firearms from people at a demonstrated imminent risk of suicide. And so it's important that during this period, the courts and law enforcement continue to facilitate and ensure compliance with these orders. Finally, I just wanted to mention the National Suicide Prevention Hotline and the National Crisis Text Line. These are great resources to be aware of if you aren't already. They can provide both crisis support services, but also help to connect individuals and families to resources related to safety planning and suicide prevention. And so with that, thank you all, and I'm going to turn it back over to Sheila.
Thank you so much, Kelly. That was also very, very, very informative, and I'm sure you'll have a number of questions when we get to the Q&A at the end. At this time, I want to pass things over to my colleague, Allison Anderman. Allison is Senior Counsel at Giffords Law Center, and her area of expertise includes helping cities and counties around the country enact effective local gun safety laws and passing extreme risk protection order legislation. So, Allison, I'm going to pass things over to you, and if you could start off by just telling folks a little bit about your background, that would be fantastic.
Thanks, Sheila. So yes, I've been an attorney at Giffords Law Center for over 6 years, and I help state, local, and federal legislators draft and enact gun violence prevention policies. In particular, I have worked with dozens of state and local jurisdictions to write safe storage and child access prevention laws over the several years. So, also, thank you to everyone for taking time out of your day to attend this webinar. And thank you to my colleagues, David, Julia, and Kelly for the excellent information that they've already presented. I'm going to talk today about the risks of more guns in the home as a result of panic buying and the increased importance of safely storing those guns to prevent the very real risks that accompany guns in the home. So as David aptly covered, there has been a surge of gun buying in the US, and as a result, there are more well, we think there are more first-time gun owners in the country and more guns in the home. And so I just want to read a couple of quotes from people who are buying guns right now to underscore that people are buying guns because they are worried and they feel that a gun will make them safer. So one recent gun purchaser said, "I don't think society is going to crumble, but I'm a person who said that if it did happen, I'd feel pretty stupid if there was no way to defend my family." And a gun owner who already owns several guns but was stocking up on ammunition said, "I don't want to say my family are doomsday preppers, but we prep for situations. This is my house. This is my compound. If someone breaks in to hurt my family, we've got to protect ourselves and we've got to be stocked up." And it's no wonder that people think that buying a gun is the ultimate thing to keep them safe. Next slide, please. I'm going to review some recent tweets by the NRA that promote this message that having a gun is the paramount thing to keep you safe. So one tweet said, "Gun-hating politicians won't like this, but what do they expect? Releasing inmates while closing gun shops during a pandemic." Another tweet reads, "Americans are flocking to gun stores because they know the only reliable self-defense during a crisis is the Second Amendment." And they retweeted something from the Federalist Society that said, "Owning a gun is like keeping a spare tire in your trunk, a first aid kit at home, or an emergency savings account. We hope never to use them, but we're glad we have them." Next slide, please. Now let's look at some of the results of gun buying during a crisis or during this time of COVID-19. A New Mexico man accidentally killed a 13-year-old with a gun he said he was using for protection against COVID. A man in Georgia pointed a gun at people wearing medical masks and gloves because of a fear of catching the virus. And a man with a felony conviction was arrested in Maine for firearms possession, and he said he needed to protect himself with this gun during the coronavirus outbreak. But feeling safer with a gun does not equal being safer with a gun. I just read some anecdotes showing that guns intended to be used for safety during a pandemic actually result in harm. But there's plenty of science showing that feeling safer with a gun does not equal being safer with a gun. Harvard researchers in particular have put out a bunch of papers showing that guns are rarely used in self-defense. And if you are attacked and you have a gun, you're no less likely to be injured during that attack than if you took certain other types of protective measures like calling for police during the attack. And in fact, some other research suggests that having a firearm when you are attacked may make you more likely to be shot during that attack. So not only does having a gun generally not make you safer, but keeping a gun in the home makes people in the home much more likely to be shot with those guns. And as Kelly already did a great job of covering, a gun in the home actually triples the risk of a suicide death. And it also increases the risk of homicide in that home. And as Julia did a great job reviewing, as guns in the home are much more likely to be used to intimidate an intimate partner than to prevent a crime. And when an abuser has access to a gun, a domestic violence victim is 5 times more likely to be killed. And guns in the home, when they're not stored safely, present serious risks, in particular to children, teens, and young adults. So even before millions of children, teens, and young adults were at home for prolonged periods of time due to the coronavirus, we knew that approximately 4.6 million of them were living in homes where guns were kept loaded and or unlocked. Now we have all of these people at home, and we have more guns in households as a result of panic buying. And unsecured guns in the home are a particular threat to kids, teens, and young adults. And I'm going to go over just a few incidents in the media that have occurred when minors had access to guns during this time period. So on Friday, April 3rd in Arkansas, a 14-year-old shot and killed her 13-year-old friend while the two were playing a game of hide and seek, and they discovered a rifle. On Monday, April 6th in Oklahoma, a 17-year-old shot and killed his 60-year-old stepfather during an argument. And on Monday, April 13th in Georgia, an 8-year-old shot a 2-year-old while playing with an unsecured and loaded handgun they found in the home. So again, those were anecdotes, but the science is clear on this too, that unsecured guns increase the risk of unintentional shootings. 73% of children under age 10 who are living in homes with guns reported knowing the location of their parents' firearms. And of those, 36% admitted that they had handled the weapons. And nearly a quarter of parents did not know that their children had handled the gun in their house. Also, between 2009 and 2018, 888 children under the age of 18 died from unintentional gunshot wounds. 598 of those children were 14 years old or younger. And very sadly, especially for me as a mom, who I have 2 young kids, children living in the US are at much, much higher risk of unintentional shootings than their peers in other high-income countries. Children between the ages of 5 and 14 are over 20 times more likely to be killed in unintentional shootings than in other high-income countries. And as Kelly already covered, unsecured guns increase the risk of suicide for minors as well as adults. Easy access to guns significantly increases the risk of death by suicide for everyone, but this is especially true for college-age young adults because of their higher rates of serious mental illnesses. So individuals ages 18 to 25 experience the highest rates of serious mental illnesses of all Americans, and suicide attempts that result in death or treatment in a hospital peak between the ages of 16 and 21. And young adults who, as we've just seen, are disproportionately at risk for serious mental illness are also particularly dangerous with access to unsecured guns. Because of the well-documented processes that take place in the brain during this time period, young adults are more likely to engage in risky and dangerous behavior. In fact, 18 to 20-year-olds are only 4% of the US population, but they commit 17% of gun homicides. And 18 to 24-year-olds also account for a disproportionate percentage of arrests for homicide and violent crime in general. Despite these risks and these unsettling statistics, there is good news. And the good news is that by safely storing firearms, which means keeping guns separate from ammunition and guns stored unloaded and locked, gun owners can save lives. A 2019 study by Harvard researchers suggests that even modest increases in the number of American homes safely storing firearms could prevent almost a third of youth gun deaths due to suicide and unintentional firearm injury. And 27 states and DC have enacted a wide range of child access prevention laws that we refer to as CAP laws. And these laws impose liability on gun owners who allow minors to access firearms. And there have been numerous studies over the past 20 years that have found that CAP laws can reduce suicide and unintentional gun deaths and injuries among children and teens by up to 54%, with the greatest reductions occurring in states with stronger laws. And safe storage practices have been proven effective at reducing gun suicide among adult gun owners as well as minors. So one study actually indicated that people who stored their firearms safely were less likely to die by firearm suicide than people who stored their firearms unlocked and or loaded. So what can you do as listeners and participants in this webinar to promote safe storage practices in your communities? Well, if you are a legislator or an advocate, you can amplify the message that safe storage is crucial. And you can do this on social media, through public service campaigns, and in op-eds or letters to the editor. And unfortunately, many state legislatures closed prematurely this year or are now out of session. But you can think about whether your state needs a cap law or needs to strengthen an existing law. And Giffords Law Center can help you with this. You can also determine whether there are other policies that can be enacted to improve safe storage practices. So California had a bill pending this year, AB 276, that would require K-12 school districts to send notices home to parents once a year, notifying them of state laws that require them to store guns safely to prevent access by minors. And if you are a gun owner, you can safely store your firearms and encourage a discussion about safe storage among friends and relatives who are gun owners. Even when social distancing mandates relax, if you are a parent, you must make sure to always ask if guns are stored safely before allowing your children to play at someone else's house, or even when you and your child are going to someone else's house, because the children may go off and play unsupervised. And so now, perhaps more than ever, we must call upon gun owners to be responsible with their guns to save lives. Thank you.
Thank you so much, Allison. That was really interesting, and really appreciated the recommendations at the end as well. So at this time, I'm going to transition over to my colleague, Tiffany Garner. Tiffany Garner is our Community Violence Initiative State Manager here at Giffords. Tiffany has a background as a mental health therapist, and she's also worked with law enforcement and violence prevention for over 13 years. So I'm going to transition things over to Tiffany. And Tiffany, if you could just get started by giving us a little bit more about your background, and then we can just jump right into the webinar.
Thank you, Sheila. Good afternoon, everyone. I hope everyone is staying safe, staying healthy, and thank you to all my colleagues who've come before to share some really interesting information. I have just added on here, but just to give you guys a little bit about me, I started at Giffords about 6 months, so I feel like I am a newer kid on the block here at Giffords, but definitely not new to the violence prevention world. As Sheila mentioned, I have experience working in mental health, also doing a lot of work with law enforcement, but also working a lot on some federal grants around what law enforcement and community organizations can do to help prevent crime and reduce violence in some of their areas. So anyway, today, I definitely wanted to spend a little bit of time talking a little bit about the community violence. I know that tends to be a question that is coming up amongst some of our partners or some of our organizations on the ground to understand this prevalence of what community violence is, especially in the midst of COVID. So next slide. So one of the challenges that we're facing is that a lot of our communities are still having this ongoing thing with gun violence. Some of the rates have either remained the same or have increased. And maybe this is following this webinar and just kind of marinate a little bit more on community violence in your area. It might be good to take a look at what your current gun violence rates are. But with the shootings and murders taking place, primarily, we go ahead and identify this is a lot in our communities of color. Even doing these shelter-in-place orders, it has a lot of our local leaders and community orgs understanding why this is. I was recently reading an article in The Guardian that it kind of shared a little bit about what's going on in Chicago, and not to obviously spotlight Chicago, but it was just talking about how the mayor and how the town is looking at this as two pandemics, gun violence and then there's COVID going on. But the truth of the matter is, if we really take a little bit of a step back, gun violence has been going on prior to COVID. And so, of course, COVID comes on the scene and now exacerbates a lot of the issues that were already there. So we have a lot of cities now focusing on the COVID response and funneling resources to eliminate the virus, but we have to look work with our leaders and kind of tap into the answers as to how to combat the virus while also reducing some of the violence that are on the streets. I want to, go back for me 1 second. I wanted to look at this with you guys to just kind of look at this quote. And again, not trying to spotlight Chicago at all, because I know some of our other leaders are, speaking out, against this, and maybe some of the other major cities. But Mayor Lightfoot had mentioned, unfortunately, the epidemic of gun violence continues to plague us every day. And of course, we know this violence of any kind is never acceptable. So this is reality for a lot of our cities. And even though in some of the maybe less populated cities, it is still, like I said earlier, is worth taking a look at. Even if your gun violence rates have stayed the same, that's still time for us to look at why is that, and we can still funnel resources and try to figure out why our gun violence is there. But especially those cities who are experiencing a rise and an increase, it's time for us to kind of look at that. So I'll touch on this in just a minute. Of course, we know it continues to impact and devastate, and why. So let's go to the next slide. I'm going to show you guys just a little bit of a clip of a video. This is probably, for those of you all who are in larger cities, this is probably not an uncommon thing to watch clips such as this. Not that it's smaller areas don't experience this, but I want you guys to take a look at the realities of what's happening on the ground right now. So if you could play this for me.
Communities in our area are not only dealing with COVID-19, but also a new round of deadly gun violence. Shantae Lands has more from Trenton.
Trenton's mayor announced a citywide curfew that starts tonight at 8 p.m. and will go till 6 a.m. indefinitely due to the coronavirus pandemic. This after 7 people were shot in this city, 2 of them killed. And over in Chester, a 7-year-old boy was shot and killed. Gunshots rang out on the 2600 block of Swart Street in Chester around 9:30 last night. A 7-year-old boy was found laying on the ground after he was shot in his face and killed, police say, by a stray bullet. Chester police identified the child as Sincere Parker.
I'm heartbroken.
Chester Mayor Thaddeus Kirkland announced that surveillance video helped detectives find the stolen vehicle involved in the shooting. The mayor announced that police will increase traffic stops due to missing taillights and license plate problems in an effort to search vehicles for illegal guns. The city will now also close all outdoor basketball courts to help with social distancing amid COVID-19. Police officers are extra careful.
We've been very blessed to not have any of our officers infected at this time.
Over in Trenton, first responders were kept busy in New Jersey's capital city. Within 4 hours, 7 people were shot during 3 separate shootings, 2 of them killed. On top of the violence, the city has a shrinking force after the health department confirmed that 5 police officers and 3 firefighters tested positive with COVID-19.
All right. So, of course, such a tragedy to see a young person or anyone lose their life. Everyone's life, it does matter. But just wanted to show you guys that little bit of the footage there. And like I said, suppose you all are seeing some things going on within your area. I also didn't want to just target Philadelphia. This was their news footage in Trenton, New Jersey. But other cities, too, are experiencing some of these tragedies. And we've got to continue to do what we can to reduce some of the gun violence, especially in these high-risk areas that were there, like I said, prior to COVID. So if we could look at some of the next slide, some of the challenges that are facing some of these communities that may, and some of these may answer the question, why this is going on right now, and why don't we see folks going home and staying home, such as some of the messaging that is out there. So first thing I wanted to mention is that I alluded to earlier that what COVID is to certain people, like this first bullet I had just mentioned, that COVID epidemic doesn't mean the same thing for everybody. And of course, we've seen that some communities are experiencing higher rates here, that people who are really trying to focus on surviving on the street, this COVID epidemic really does not register the same as it does for maybe some others. To most, COVID is alarming. We are heeding to the recommendations for staying home, for doing this, wearing masks, all those, taking the precautions that we need to prevent the spread. But for some impacted communities, which are a lot of our communities of color living in these areas prone to high rates of gun violence, this is a challenge. Like I said, because some of these issues are going on prior to. the focus is now, it's really have been and still is on survival. And people living in these communities, they oftentimes can see now with this COVID spread, all these resources poured into the city to combat the virus, but those same efforts haven't been poured into the communities even prior to COVID. So if a lot of communities see the impact of the virus, they see the immediate response developed by our officials, which is not necessarily a bad thing, but yet these communities have been experiencing fear and death and been disenfranchised for a while. You know, it's kind of the thought of what is COVID when you have felt perceived inferior treatment and you're, you know, but prior to, your focus is still probably and likely going to continue to be on just surviving every day. So it may not be the same reception to some groups just because they're in the midst of dealing with this, and hey, they've been dealing with this prior to COVID. So we may not see that same, registering the same for some of these communities. Another bullet here I have, lack of access to testing and supplies, which includes masks. So some communities may often experience a lack of access to testing sites. I know in the news, people may talk about pop-up testing sites, but here goes some of the challenges that a lot of our communities face is maybe there's a transportation issue, and then upon arrival, maybe they need referrals. Well, here brings up some of our issues that we have with inequalities. Some may not have access to healthcare to get referrals to, due to cost or some of the other challenges, and they may not have a way to secure this referral to get testing. So as we look at this intersection of gun violence and COVID, as we have probably heard some in the news, especially how it affects African Americans, you're uncovering some of these inequalities. So also some of these communities have challenges gaining full access to masks, as we know that is what we need to do to help stop the spread. Some communities do not have access to these items. So sometimes I think for those on the webinar, it may be worth considering, what are extra special efforts being done to some more vulnerable communities to help secure masks to protect them as well. We also look at the lack of culturally specific public health messaging. Many individuals living in communities dealing with gun violence, they may not be watching the same news channels. I know probably a lot of us stay up to date on what's going on, via your news source, but that may not be the same for everyone else. That is not to say that, some may obviously tune in, but in the event that communities are not receiving the messages the way you and I do, perhaps it's worthy to consider creating culturally specific messaging that will target communities and allow them to hear the severity of the issue in the terms that speak to them. Perhaps it could be slogans and phrases used by officials that could be rephrased or renewed with more of a cultural lens and distributed within these communities to help address the virus. Perhaps that might be a strategy we need to consider. Something else we need to look at is the furloughed and dismissed violence intervention workers. Whether you guys know this or not, violence intervention workers, violence interrupters, street outreach workers, and those who serve in similar capacities are critical to helping to reduce gun violence. This is even prior to COVID. They are essential and should always be deemed that because they are like your first responders. And why do I say that? Because when they hear violent situations going on, they are there on the scenes trying to manage the conflict. So as we are aware that COVID is now in the mix, these intervention workers are still out there, possibly in a reduced capacity to try to keep the violence down. So the challenge now comes that many organizations now have had to furlough their staff. So what does that mean for the community? That may mean a lesser or modified response to trying to squash some of the violence, or staff may have had to be dismissed due to budget cuts. So in some communities, we may see an increase just because our violence interrupters or intervention workers are no longer able to do completely their job. That's why we definitely need to keep funding coming for those organizations that deliver those services that maybe we don't really think about. Modified victim service delivery. So victim service delivery may be impacted during this time. And what does that mean? So when it comes to violence intervention, again, folks that try to, either prevent the violence or they prevent retaliatory violence. It could be your hospital responders or your workers, as I just mentioned. Obviously, right now, they're not able to service the way that they could serve gunshot patients in the hospital settings. So, because, of course, a lot of them are working from home and not being able to enter. So, that's a challenge going on right now. Victim organizations that work with families who are dealing with the aftermath of homicides or they provide preventative service are having to modify their service, doing more online outreach as much as possible. But that in turn may also not be as effective, but it's all, of course, that's just what people have to do right now. So that's a challenge we're seeing on the ground. My colleagues alluded before, when I say home does not always equal safety. We've talked, of course, about some of the domestic violence that happens within the home, and then, of course, with the safe storage, kids having, gaining access to weapons, of course, and using those weapons possibly to injure themselves or others. So that's also a challenge going on. And then we want to look at vulnerable communities, how these existed, like I keep mentioning, prior to COVID. Historic race-based policies have contributed to some of the vulnerable communities today. Many of these communities were already exposed to the challenges of healthcare, transportation, homelessness, poverty. And so if these individuals face these every day, now you add a virus on top of that, it only highlights the fact while COVID does not mean the same for everyone else, because the focus has been trying to struggle and trying to survive. But this does shine a light on the structural policies that we need to change. To really, as well as increasing funding for that too. So when these inequalities are already in place, it is often the breeding ground for violence. And then these are things that we can look at as leaders, as community organizations, can look at how we really want to address that, because this virus only exacerbates what is already there. So these are some things that we need to look at ongoing, even after COVID as well. And next slide. And so just to reiterate how important our violence intervention workers are, as I mentioned to you guys before, they're like our first responders. They are on the forefront, even prior to this COVID, addressing the violence and the trauma, because I think sometimes we forget how trauma impacts communities or impacts individuals, which impacts communities. They're our credible messengers. They resolve the conflict. They keep the peace. And as I said, we should always deem them as essential. One of the things that we're trying to make sure that we sound the alarm on from Giffords' standpoint is to make sure that these organizations that serve and provide these intervention workers, that they always have priority funding. We're trying to champion that cause, and we're encouraging other people to do the same, just so because they help keep communities safe, they help keep people safe. We are also, I'm just putting a plug out there, we just released a memo today to some of our parties, and we will disperse this out to some of our partners, that highlights the importance of champion for funding to continue to support from federal level, state level, local levels, to continue to get funding for intervention workers to continue this work, again, not only just in COVID, but hopefully following thereafter. So anyways, that is it for me today, and I'll turn it right back over to Sheila.
Thank you so much, Tiffany. Thank you for that robust presentation. At this time, I'm going to transition things over to my colleague, Adam Skaggs. Adam is our Chief Counsel and Policy Director at Giffords Law Center. And he has had a long and very diverse legal career, and where he's worked on election law issues specifically. And so at this time, I'm going to pass things over to Adam. He's going to give you a little bit more about his background, and then he's going to jump into discussing gun store closures, the myths versus the reality.
Thanks so much, Sheila. Appreciate the introduction. I have been working on gun violence issues, litigation, and Second Amendment issues related to gun violence for about the last 7 years, most recently here at Giffords Law Center. And I appreciate everyone taking the time to participate in the webinar this afternoon. I realize we've packed a huge amount of content into a long presentation. So want to just wrap things up quickly here so that we can get to Q&A and answer some of the questions that I see are already coming in. I'm going to talk a little bit about gun store closures, and the segment is titled Myths versus Reality, and the myth out there is one that is being promoted by the NRA and the gun lobby, that somehow the Second Amendment makes gun stores different and more protected than all kinds of other businesses, and that if public health necessitates closing temporarily some gun stores, this would be a constitutional violation. As I'll explain today, that argument is misguided. So we've already heard about the incredible spike in gun sales that we've seen. David, in his opening remarks, referred to the picture displayed here that has gotten so much widespread usage. And we did see this surge in gun stores with people congregating in close quarters at a time when public health officials are concerned about the spread of the coronavirus. And in addressing that and enforcing social isolation and stay-at-home orders across the country, a number of states closed non-essential businesses, including gun stores. The next slide. In response to these closures of gun stores in a number of states, the Gun Industries Trade Association, the National Shooting Sports Foundation, petitioned the Department of Homeland Security to designate gun stores as essential. They did that, DHS did that, but it's important here to note that while DHS essentially classified gun stores as essential infrastructure, that's mandatory or a binding order. That was just essentially an advisory opinion, and states are still empowered to and permitted to make decisions about what businesses stay open and what businesses stay closed, regardless of what the federal government has opined on the question. In light of the order, however, a few states that had closed stores did begin to reopen them. A number of states have now reopened gun stores or allowed gun stores to remain open with certain restrictions, either requiring appointments, limiting the number of customers who can enter or be in a store at any one time, those sorts of measures. But a few other states have kept their gun stores closed. Let's go to the next slide. The response to that was a flood of lawsuits all across the country in states from California to New York and Georgia, Massachusetts, a number of other states. We saw lawsuits, again, making this argument that it somehow is unconstitutional or violates the Second Amendment if in a time of unprecedented global pandemic, governments try to close gun stores to protect public health. So again, we saw these lawsuits filed all across the country. Let's go to the next slide. Thus far, we have not had these lawsuits succeed. That is to say, courts have generally said that based on the emergency powers and the unprecedented public health crisis, it is not unconstitutional to close gun stores. So the first case we saw in Pennsylvania, the court upheld closing the stores. In California now, we've had multiple decisions, and this has been the trend in those cases where courts have ruled on these lawsuits. In other states, New Jersey and Pennsylvania, that decided to begin limited reopening of gun stores, that litigation has basically stalled. But other states are continuing to fight. New York, Massachusetts, New Mexico have all closed gun stores and are defending from lawsuits that the gun lobby has filed. And those are still in the relatively early stage. Let's go to the next slide. Now, I think it's critical to make the point that in these unprecedented times, there are restrictions on all kinds of businesses, and there are restrictions on all kinds of constitutionally protected activities. And those are permitted under temporary circumstances during times of national emergency. So long as no one is closing gun stores, singling gun stores out, and subjecting them to restrictions that don't apply to other non-essential businesses, the longstanding precedent is that that is constitutionally permissible. You know, think about all the constitutional rights that are being curtailed at this time, whether it's free speech rights, the ability to go to political demonstrations and rallies that those Americans following the stay-at-home orders at least have agreed to temporarily give up. Things like lobbying, going to performances, art performances, those are all obviously restricted, as are religious celebrations or worship services in times when we can't get together with larger groups of people. All of those constitutional rights have to temporarily take restrictions they ordinarily wouldn't. And that's just the same when it comes to gun stores. We're in a situation where in a limited number of cases, states continue to fight to defend their decision to close gun stores. I think it's crucial to note that all the decisions about whether stores should stay open, whether there's limited reopening, whether there are no restrictions at all, these need to be made during this time by epidemiologists and public health officials, not by certainly those interested in lifting up the gun industry's bottom line. And so as we think about how to navigate gun stores opening or closing, so let's go to the next slide. The last data point I think to acknowledge is that the ATF has also issued guidance. DHS, as we said, has deemed gun stores essential. ATF has now said that it's possible for gun stores to alter their traditional business practices in certain ways to limit exposure of customers and store workers to each other, so that delivery of firearms to curbside pickup or to a location at a door or window of a store is now permitted. And it may be that with some of these practices that ATF is now condoning, there may be ways to somewhat more safely allow these stores to operate. But again, any decisions we strongly believe should be made with public health in mind. Let's go to the next slide. So the bottom line, it is permissible if public health demands that gun stores and other businesses be closed. The Constitution permits that during emergencies, and it is permissible for gun stores to be closed. I would say that while that may obviously help with the transmission of the virus, closing gun stores does raise risks of driving those who want to buy guns to the unregulated market, where they won't have background checks in many states, and also they may end up buying do-it-yourself guns, so-called ghost guns, will not be on the market without any serial numbers and traceability. So again, as with all of these dynamics, it's important that the epidemiologists and the public health experts guide the decisions made about when and how long to close gun stores. I'm going to wrap it up there and pass it back to Sheila for the Q&A, and thanks again to everyone for tonight.
Thank you so much, Adam. I really just want to thank all of the different experts from Giffords and Giffords Law Center for providing such in-depth presentations for this webinar. We've been accepting questions via the Q&A link at the bottom of the presentation. And so at this time, I'm going to ask various questions and point them to the right staff or an expert that'll be able to answer that. I do want to make an announcement that this entire webinar is being recorded. It was recorded, and it will be on the Giffords website post-webinar, and we will also be sending a follow-up email to those that registered, and it'll have the link as well so that you can get to the recording directly. So I know there were a few questions about that, so I figured I would just answer that up front. So we're going to start with a few questions for David Chipman. I'll read out the question, and then David, feel free to jump in. But we had a question posed where the current NCIS system is flawed. What specifics have been identified as loopholes and what's being done to close them? What references are available to identify the issue with NCIS? Additionally, there are guns that are being lent to family and friends. Does this increase in the data representation as identified previously? And then who's also doing the research into gun buying increase during the COVID pandemic? So I'll open that up to David Chipman at this time.
Great. Well, and great series of questions. Let me take it from the NICS system, which is the FBI's background check system first. I think it's fair to say for someone of my age, I was around when there was no background check system at all. So although the system is not perfect, there has been progress over the years. And so there are flaws within the system itself. And then there are flaws in that the system is not comprehensive and it does not cover every transaction of a gun requiring a background check. So let me talk about the gaps in the law itself. First, private sale loophole, the fact that you, between two individuals, can sell a gun outside of a gun shop and there is no background check, there is no record keeping. This happens at gun shows. It can happen through internet websites. That's a big gap in the law. The prevalence of do-it-yourself guns, where people purchased unfinished parts and manufacture ghost guns that cannot be traced. We've had felons kill police officers and others using that gap in the system. And so at the state and federal level, we have introduced or passed laws that would make background checks comprehensive in a way, and those are positive results, and we need to do that at a national level. I think one of the biggest flaws within the system itself would be the fact that if after 72 hours, the FBI is still investigating if someone is prohibited from buying a gun, that the gun dealer can, by default, proceed with the transfer. And what this means is that the speed of the transaction is prioritized over the public's safety. And we can see in mass shootings in churches and other times how that gap, that 72 hours, if extended, might have avoided, a serious crime. Those would be the major points there. And I think the Giffords Law Center website is a great resource to see a much more in-depth dissection of all those issues and some of the studies related to it. The question about family and friends, I just want to reiterate, unless you live in a state where there is a requirement that all transfers of guns are somehow registered or a license is required, those type of transfers would not be caught up in the data that I presented today, and is more an element of this private sale loophole, and you could say it a loaning loophole, whatever. So I don't think that we can describe the uptick in what we saw in the data over the last couple months with any temporary transfers or lending of guns. Largely, that kind of activity is outside of the regulatory structure, and we just don't know about it. And then finally, the question about who is doing research into gun buying itself during this event or others. Perhaps Kelly suggested in some of her talk that there had been something during SARS which was looked at. I don't think there's been a lot of research. One of the impediments to this type of research is the fact that really the in-depth data that we would need to do such research is really only released annually. It's not released in real time. And one of the things that I was happy to see over the last couple of weeks is that members of Congress had sent a letter to the FBI and ATF to seek them to make public some more real-time information so we could wrap our arms about what's going on currently, as opposed to waiting to sort of these annual summary reports at the end of the year. So stay tuned for that. And hopefully that at least responds somewhat to the first couple of questions.
Thank you so much, David. That was really, really helpful there. And again, we're only going to have about 5 or 6 more minutes of questions. Really just want to thank everybody for sticking with us through the entire webinar and the Q&A. All right, so I'm going to pose the next question to my colleague, Kelly. There was a question about recommendations for getting the word out for families that have an increased risk of suicide during this time.
Yeah, I think that's a great question. So, I think I would start by just saying there are a lot of great organizations that are doing work around this issue. So there are gun violence prevention groups like Giffords and many other groups that I imagine many of you are involved in. Also the American Psychological Association, the American Foundation for Suicide Prevention are creating really great resources that people can amplify and share in their networks and communities. The other thing I would point out is that the media has actually done a decent job sort of talking about some of this and working to make sure that people understand that there are increased calls to some of these hotlines and that those are resources that people should be aware of. So I think, there is a lot of information out there that we can share and amplify in our communities. The other piece that I would just sort of remind people of is that I think it's really important that we're talking about the risk of firearms at this time as well and how firearms relate to suicide. We have surveys that suggest that only about 15% of Americans actually believe that having a gun in the home will increase the risk of suicide, even though we have so much research that shows what a significant risk factor firearms are for suicide. So I think it's important that we're having conversation as well about the very real risks that are associated with guns in the home, particularly as people are bringing more and more firearms into their homes.
All right. Thank you so much, Kelly, for that. That was really helpful as well. We are, like I mentioned, only going to be taking a few more questions, but I did want to point out that, if we don't get to your question, that, experts' emails were on the slides that we posted. If you missed it, that will be, sent out, like I mentioned, and will always also be on the website. So you could always send a follow-up email to the expert directly if you had a question for, Julia or for Allison or David or Adam or Tiffany. But we will take a few more at this time. And so the next question that I'm going to pivot on over was for Allison. And Allison, you offered up a few examples of children who would use guns for homicide, and we were asked if you could repeat that and just kind of expound on that a little bit.
Oh, yeah, I saw that question, and I think it was just to repeat the examples. I will include a link to those examples in the slides because I'd rather get to some more substantive questions. I know there was another question asking about enforcement of safe storage laws and whether they're effective without criminal penalties. So if you don't mind, I'm going to just address that one.
Sure, jump in.
Okay, so I think that's a really good question. And I want to say that at Giffords Law Center and Giffords, we're trying to be acutely aware of and sensitive to the disproportionate impact of policing on underserved communities and communities of color specifically. So with that in mind, we are trying to think of ways to enforce safe storage laws that don't have criminal penalties. And there have been some discussions about making people civilly liable if they don't store their firearms safely and it's used to injure or kill someone. That said, I am not aware of any research that looks at non-criminal penalties and their effectiveness. In fact, I am aware of the opposite research that has shown that states that impose felony penalties for violations of child access prevention laws are more effective than states that have lower criminal penalties.
Thank you for that. Thank you for that. Okay, we will take one more question then. And I will direct this final question, or the final two questions actually, to my colleague, Adam. And so, Adam, there was a question about gun stores checks on buyers' ability to use a gun at drive-through windows. And then additionally, there was a question about what are new gun owners being advised as far as learning how to use their guns. Are firing ranges still open? And if any other colleagues want to jump in, please feel free.
Yeah, as to the, the latter question, there have been some states that have closed gun ranges. That has also been subject to litigation. I think in most states they are open, and it may be that there is an ability for a new gun owner to receive some training, but of course, much of that training requires being in close proximity to at least human being, the instructor, and the ability to effectively train a new gun owner and maintain public safety measures like social distancing may be incredibly difficult or impossible. As to gun stores trying to take advantage of ATF's new relaxed policy, there may be some gun stores that can implement some new practices consistent with that will reduce at least some exposure and risk of virus transmission. And there may be some stores that can't. And there may be some parts of these transactions that really do require physical proximity between the store, the dealer, and the customer. And so I certainly don't want to leave any impression that ATF's guidance is in any way sufficient to allow these stores to operate without any risk of virus transmission, although some may be configured, their property may be configured such that there is an ability to use a window for, handing over some paperwork, parts of the transactions. So there may be ways to limit the prolonged exposure, but I certainly think there are parts of that process that just simply, when they require handling of merchandise and handling of paperwork between one individual and another, that the ability to do that without any risk is not going to be possible. So there are stores, to the question, that I think are not going to be able to conduct every aspect of a sale transaction through any sort of remote access.
Thank you so much, Adam. And so that brings us to the conclusion of the webinar. I know that we did have a number of other questions that came in over the last 5 or so minutes. And like I mentioned earlier, what we will do is we will connect, individuals with our experts, and they'll be able to answer that directly. But like I also mentioned, we do have contact information for the individuals you heard from today that were on the slides, and that will be on the recorded link that will be posted on Giffords' website. So at this point in time, I do want to thank all of you once again for, logging on, joining us for the last hour and a half. We all know that these are unprecedented times, and we really do want people to understand that there is an intersection, and it is tragic, between gun violence and COVID-19. And, we hope that this webinar was able to cover some of the critical issues that, have come up for you all during this challenging time. We're working our hardest to be able to provide as much information as we can and make recommendations as we see fit. So thank you again for attending, and until next time, everyone have a great afternoon.